all three elements of the hip, ilium, ischium, and pubis contribute to the articular socket for the head of the femur, also known as the acetabellum. So right now we're looking at an innominate pelvis bone, and we're going to focus on the ilium. The ilium is a fan-shaped bone that forms the superior and posterior portion of the pelvic girdle. To begin with, we're looking at it in a lateral view, and most superiorly we have the iliac crest. At the anterior end of the iliac crest, we have the anterior superior iliac spine, and then we have the anterior inferior iliac spine. On the posterior aspect of the ilium, we have the posterior superior iliac spine and the posterior inferior iliac spine. And just below this, we have the greater sciatic notch. Okay, so the following area that I'm going to be focusing on will be the ischium. In order to distinguish the ischium, we have an L-shaped bone making up the inferior and posterior portion of the pelvic girdle. Right now I'm holding the pelvic in a medial aspect, medial point of view. And we have the ischial spine, and just below it we have the lesser sciatic notch. And right below the lesser sciatic notch we have the ischial tuberosity. Now the last portion of the video includes the pubis area. So we have the pubis symphysis right here, and we have the superior ramus right up here, and the inferior ramus of the pubis right here. Perfect. And a better view of the pelvis is right here. So we have the obturator foramen, which is this circle right here, and pubic arch and the pubic symphysis. A key difference in differentiating whether this is a female or male pelvis would be the shape and size. If you clench your fist up and you can put it through, chances are is that this is a woman's pelvis, because a female's pelvis needs to be bigger and broader in shape as a child's head needs to fit through. So right now we're looking at the femur in an anterior view. In order to distinguish the left and right femur, we have to look for the head of the femur on the proximal end, and the head is always pointing, facing medially. So we have the greater trochanter here and the lesser trochanter here. Now we have the femur in a posterior view. Right here we have this little line is the linea aspera. This is where the hamstring muscles attach. And on the distal end, we have the lateral epicondyle, medial epicondyle, and the intercondyle fossa. So the patella is a sesamoid bone, meaning that it is free-floating. We have the base on the superior end, and we have the apex on the inferior end. In order to distinguish whether it is right or left patella, you have to lay it down in standard anatomical position. And the side it leans on will be the side it belongs to. So this patella is laying on the right side, so therefore it is a right patella. The following bone that we have here is the tibia. The tibia supports the weight in humans. On the proximal end, we have the lateral condyle of the tibia and the medial condyle of the tibia. On the distal end, we have the medial malleolus. Okay, so the following bone that we have here is the fibula. It is also known as the calf bone, and it is located on the lateral side of the tibia. So right here, we have the lateral malleolus of the fibula, which forms the lateral ankle. following bone that we have here is a left foot, and we're going to be observing it in a superior or dorsal extension view. So to begin with, it is composed with phalanges, metatarsals, and tarsals. The phalanges is subdivided into distal, intermediate, and proximal. So we have distal phalange, intermediate phalange, and proximal phalange. However, your big toe is only composed of the distal phalange and the proximal phalange. The next set of bones include the metatarsals. So we have first metatarsals starting on the medial side of the body, working yourself to the lateral side, second metatarsal, third metatarsal, fourth metatarsal, fifth metatarsals. The following bones that we have here are the tarsals, and there are 7 bones make up the tarsals. So a saying that I used to remember this is, the circus needs more interesting little clowns. So talus, calcaneus, navicular, the medial cuneiform, intermediate cuneiform, lateral cuneiform, and the cuboid. So the circus needs more interesting little clowns. And that concludes the bones of the foot.